Hello and welcome back to Honey Blushed episode number 4. My name is Jennifer Becker. I'm PA and co-owner of Suvita Medical Aesthetics. And this is the beautiful Dr. Miraglia, co-owner and medical director of Suvita Medical Aesthetics. Thank you for coming.
Thank you. Hi, everyone. It's so nice to be here, and thank you for having me on this episode.
Girl, it's your house. Finally, we're together in one room. We're usually running around at different places.
Yes.
It's been a little crazy, like trying to coordinate both our schedules, but we did, and here
For
we
sure.
are. So I was just wondering, there's been a lot of talk about disparities in women's health care, and, Halle Berry is so excited. She's finally advocating for us.
Yes.
So what is your take? What is your feeling on that?
I was super excited to see the little clip from Halle Berry. I mean, for me, it is a bright light in the right direction that we're finally talking about these issues that have sort of been dusted under the rug. Who doesn't love Halle Berry? She's beautiful. She's nearing 60 years old and she looks phenomenal. She's honestly a sex icon, if you ask me.
She's killing it for sure.
Right?
Definitely.
And she's there and she's opening up about what it's like to go through menopause and how frustrated she is that really no one was there to address it or help her understand it or help walk her through it, address symptoms, and really is starting to lobby for women. And I think it's awesome.
The sad thing is the conversation stops once you call your physician and you're like, hey, I want to schedule an appointment. There are certain issues that I want to discuss. And the front desk is triaging you. I find that extremely frustrating. Like, I don't need a triage. I just need you to schedule my appointment, please, because I would like to discuss what I need to discuss with my doctor. So that in and of itself is extremely frustrating. Fast forward to the appointment. Hey, what's bothering you? Kind of run through your symptoms. Oh, were you cycling? Yes, I'm cycling. Oh, you still have estrogen, you good. They just kind of like almost blame it on this crazy lady sitting in the chair.
Agree.
So I'm tired of our complaints not being taken seriously.
No, definitely. And I think it's sort of dusted under the rug. I think the assumption is that, of course, every woman is going to go through menopause. We know that we're expecting it. There's also this perimenopausal period as well that is not spoken about too much as well, where people have symptoms. But the expectation and assumption is every woman will go through menopause, and that's what it is. There's really no one there to help them manage their symptoms or really discuss any further symptoms they may have that affect their whole body, to be honest with you. The conversation just stops. Congratulations, you're in menopause. It's over.
Just roll over and die. It's okay. You could live a sexless life for the rest of your life.
Right.
Like there's no one that really even cares enough. Like there's no research.
Yeah.
There's not enough research. But the second a man has a problem with ED, it's a rush to the testosterone clinic. And don't misunderstand me. I love treating men. I love doing hormone replacement for men. But if you research sexual wellness centers in your area, you will find probably about a bazillion T clinics.
They're everywhere.
And not a single women's health clinic. Now, I mean, aside from your GYN, but the GYN isn't enough. They're just not giving us enough time. It's like, okay, PAP's done. Yeah, I'll call you if there's anything abnormal. And how I'm feeling gets swept completely under the rug. Essentially, I could be miserable for years and years.
Well, because I think also the training for OBGYNs, not that it doesn't touch on menopause, it certainly does, but it's not all encompassing. They really are not getting fully trained on every sort of possibility for treatment. And thus conversation's not there, or they're in the same situation as us, which is they may not have a treatment modality to offer. So it's sort of pushed away.
Right, because the research isn't being done. But now hopefully
now, yeah,
we're moving in the right direction.
Because you're right, men's health and their hormonal health, well-being, emotional well-being, and testosterone replacement is really important, but that doesn't mean women's health is less important, but it sort of is taken that way.
We know that men's testosterone declines after the age of 30. It trends downward, but it's not like their testicles go on a holiday. I mean, they're still producing hormone. I mean, I can't even imagine how men would feel if their testicles completely shut down, which is essentially what's happening to us.
Yeah.
Our ovaries are like done, kaput, shut down, and we're just expected to grow old and wrinkly and tired and cranky and sexless.
And to be honest, most of what's talked about is the treatment for overall, medical well-being, such as, oh, you're having vaginal dryness, which may cause UTIs. Okay, let's just do a topical estrogen cream, which is really important. But what about vaginal dryness, which affects, sexual intercourse and pleasure? What about those things as well? Sort of dusted under the rug. And I think I have to say we're partially to blame too. I think the most exciting thing about Halle Berry is she's really putting it out there. She's not afraid to discuss this, but I have to say, even for myself, only in recent years have I been more open to discuss this. And maybe it's because I'm also approaching that age where I'm starting to go through perimenopause too. And so I've allowed myself to open my eyes a little bit. But I have to say that, as providers, we're a little bit at fault too. And now finally that conversation is happening and moving forward.
Our fault to a point, agreed. But
the research isn't there.
The research isn't there. And to be fair, preventive medicine for me was like, what, a month or two? And it just scratched the surface on like statistics and data. We basically only talked about diabetes, hypertension, heart disease.
And cancer, right?
Right, and cancer. How do I forget that? We didn't learn anything about sexual health, honestly, and how to address those issues. And it should be addressed. It's part of overall well-being. I don't understand why that part is being skipped over. I don't understand why we're not being taken seriously. It's actually frustrating and infuriating, if you ask me, that this is even going on. If this is still going on.
I know. Well, every day you hear, right? 40 is the new 20, 50 is the new 30. But if that's the case, then all aspects of our lives should be addressed at that point. But for women, it seems that we have our children. We reach a certain age where we're starting to go through menopause, and then it is what it is. It's sort of to lie at the wayside. And I think I agree with you. It is quite infuriating.
Just to give you for an example, I'm going to share something personal, a couple of personal things that happened to me even before this age, before perimenopause. So when I had Alessia, she came fast and furious. Like there was no time for anything. Like my doctor missed the delivery. Extremely vulnerable. I was extremely vulnerable because I'm in excruciating pain. The little resident that was taking care of me was like, okay, we're going to cut now. I'm like, cut what? Cut what? Oh, you're not going to feel it. I'm like, no, I'm going to feel it. I'm like, please, please, please. I was crying. Please numb me. Like, I really think she was going to cut without giving me any local anesthesia. And I felt that needle, even with the terrible contractions, I felt the pinch of the needle. So can you imagine what I would have felt if she hadn't numbed me up? Like, why are we treated as subhuman? And this was a female, young resident gynecologist that treated me this way.
No, you're right.
And even after that, here's another story. I had a suspicious pap smear. I had a colposcopy. Oh, don't worry, it's not gonna hurt, just a little bit of pressure. And I'm sitting there, it's like, okay, I thought it would be like, here, just bite down on this. Like, it did hurt. It wasn't pressure, it hurt. Like getting a biopsy of your cervix hurts.
Yeah. No, honestly, just getting a pelvic, it's a very uncomfortable procedure, right? It's embarrassing, you're very exposed. I've been very lucky with the OBGYNs I've gone to. I've always felt that they've been super gentle and cautious, but I've seen and heard many horror stories as well. But I think, women's healthcare certainly needs to improve. It's not where it needs to be. And I will tell you, for my last C-section, the third one, when it was like maybe two days after delivery, they had to come and remove the tape. Mm-hmm. And he literally was like, oh, I'm just going to check your wound. I'm just going to check your, the scar, make sure everything's looking okay. Looked and just ripped. Did not even say that he was going to remove the tape. And I remember I screamed because it was surprise. I think he did it maybe to make it less painful, like that ripping off a Band-Aid. It was horrible. That I distinctly remember. And I didn't experience that with my other two.
I actually have a really awful story that is not my story. A patient shared with me. Probably about 15, 20 years ago, she went to a local GYN in the area, unfortunately. She had suffered a miscarriage. And doc said, hey, let's just take care of this tonight. Just come back to the office later. And as a patient who trusts her physician, as a layperson who doesn't exactly know what a DNC entails, put her faith into her doctor, came back alone. She needed someone to take her home. And without any anesthesia at all, she had a DNC at the doctor's office, outpatient.
Wow.
Barbaric. That doctor should be stripped of her license.
Yeah, it's
awful.
I mean, the patient's well-being is at risk, and that's the scariest part.
It's really, really heartbreaking that this beautiful woman had to really endure that. It broke my heart. It nearly brought me to tears, to be honest with you. It really, really did. It was so terrible hearing that story because I know and I've seen DNCs performed. You know what that entails.
Of course.
So I cannot even imagine that being done to me on the table without any anesthesia at all.
We don't even do colonoscopies that way.
No.
If we're honest, right?
No.
And those are not really too invasive. I mean, maybe you get a biopsy, maybe, but we don't even do them that way. I mean, that is a shame. It goes back to, again, the needs of women. They're not met in the same way in healthcare. They're not held with as much weight. They're certainly not as well understood. And this goes even if you want to talk about postpartum depression and how the idea of that was suppressed for a very long time. And the implications for postpartum depression are far too great, right? I mean, it could be loss of a child, homicidal loss of a child. It could mean suicidal loss of the mother, destruction of the family, right? And it's something that can very easily be addressed because you're seeing this patient regularly postpartum if you ask the right questions, right? Because many depressed people don't come to you and say, hey, I'm depressed. You have to ask those questions. You have to care about what that woman's going through. And we know that one of the most difficult times for a woman is the postpartum period with a newborn.
Oh gosh,
I mean,
for sure.
I have PTSD from that period, sleepless nights, feel like a zombie. Whether you're breastfeeding, bottle feeding, you're feeding that infant, changing that infant, worrying about that infant 24/7, so much so that you really don't worry about yourself or think about yourself for at least a few months. No one's really looking out for you.
No, you're just expected to just do it like a robot.
Everyone
go home
takes
like a
care of you when
robot.
you're pregnant.
Right. We need to be doing better. I
We
guess the
do.
take-home message is we need to be doing better. And as far as talking about it, we are talking about it. That's how Honey Blush was born. And we are having these conversations. Sam is behind the camera. Sam, say hi.
Hi guys.
We're out here, we're doing this. And also we are extending treatments here that are available to both men and women. Nothing against, like I said, nothing against men. This has nothing to do with men. It's a fact that there is a huge disparity in the way that we are treated in healthcare. And it needs to change. And we're really happy that we have Hollywood out there looking out for our best interests, because hopefully they'll listen to them, right? Halle Berry, hopefully they'll listen to her.
We
she's
heard
fabulous.
it, and it definitely caught my eye. And again, like you said, something like this, Honey Blush, super important. If one female watches this and then chats about this with her girlfriend and feels comfortable talking about it, and then so on and so forth, and that message spreads, and people are less fearful of speaking up about what they're going through, what they're experiencing, whether it be menopause, whether it be postpartum, whether it be GYN health, whether it be emotional wellness, I think then we've had an impact.
Definitely. We do have the time for you here, fortunately, and we do want to be the change, and we do have specific treatments that may help you. So please, or we can even try to guide you in the right direction, or I'm not going to say try, we will guide you in the right direction at the very least. So if you have any questions, any concerns, just please schedule a consultation, or if you're already one of our patients, schedule an appointment, and you know that we're always happy to listen and to help.
Part of getting your glow back, which is our sort of motto here at Tuvita, is, your inner glow as well, affects your outer glow, right? How you feel inside definitely reflects on how you appear to yourself outside as well.
Definitely. These are conversations. These are completely subjective. This is how we feel. Mm-hmm. We're just bringing these topics to the table. This is not medical advice. Like I said, if you have any questions, call your doctor or call us to schedule a consultation. We're happy to see you here at the spa.
Hope to see you soon.